My name is Allison Payne, and I will be explaining my specimen collection checkoff. Upon entering a patient's room, always identify yourself and perform hand hygiene. Then identify the patient using two forms of identifiers: the patient's name and their date of birth compared to their hospital ID band. Then explain the procedure and the need for the specimen collection to the patient. Before beginning any specimen collection, you need to ensure that you have check labels, complete the lab requisition, and ensure the patient's privacy by assisting them to the restroom, closing the door, or closing the curtains. Then after every specimen collection, you're going to label the specimen container properly with two identifiers, the date and time of the specimen collected, and the type of specimen collected. If required, you're going to place the container in a biohazard bag and always send collected specimens to the lab immediately. Okay, with a wound culture, you're going to begin by performing hand hygiene and applying gloves. Then with an antiseptic swab, you're going to clean the wound starting from the edges going outward. Then remove the old exudate. Dispose of the swab and then dispose of your gloves and perform hand hygiene. Then you're going to open the culture tube kit and begin apply sterile gloves and begin obtaining the culture. For an aerobic culture, you are going to take the swab out of the culture tube, swab the wound drainage, rotating gently, and then place the swab back in the culture tube, crushing the medium in the tube, and pushing the swab into the liquid in the tube. For an anaerobic culture, you're going to take the swab out of the special anaerobic culture tube and swab deeply into the draining body cavity, rotating gently. Remove the swab and place it back in the culture tube. After every collection, make sure to perform hand hygiene. Remove gloves and perform hand hygiene. Okay, and then for a sputum culture, you're going to begin by offering the opportunity for the patient to rinse their mouth out with water. Then you are going to provide the collection cup, instructing patient not to touch the inside of the collection container. Instruct the patient to take three or four slow, deep breaths, fully exhaling, then a full inhalation followed by a forced cough, expediting the sputum into the container. Repeat until you have obtained 5 to 10 milliliters of sputum in the container. Close the container and seal the cap tightly. Then label and send to lab and perform hand hygiene. Dispose of gloves and perform hand hygiene. You can also do a sputum culture by a suction by putting a catheter into the nasopharynx, esophageal tube, or the tracheostomy. And of course, after performing that, you would perform hand hygiene before exiting the room. Then for a throat culture, you're going to have the patient sitting in an erect position on a bed or chair. Instruct patient to tilt their head back, open their mouth, and say ah. Insert the swab into the mouth area, ensuring not to touch the lips, teeth, tongue, uvula, or cheeks. Swab the tonsillar area side to side, ensuring to swab all inflamed and infected areas. Remove the swab and avoid contaminating it by touching any of the oral cavities. Remove your gloves and perform hand hygiene. I'm going to go correct myself at the beginning of that. You perform hand hygiene and apply gloves prior to obtaining the throat culture. And then we're going to move to a hemocult stool culture. For the hemocult stool, you're going to obtain an uncontaminated stool specimen, and with a wooden applicator, you're going to perform hand hygiene and apply gloves. And then with a wooden applicator, you're going to get a small amount of stool and then you're going to open the hemocult testing slide, place a small thin layer, smear a small thin layer onto the first box, then from collect another specimen, fecal specimen, from a different part of the stool sample, and thinly smear it onto the second box. Then close the slide and flip it over. You're going to lift the cardboard flap on the back of the slide, applying 2 drops of hemocult testing solution to each of the boxes. The test results should appear in 30 to 60 seconds, and note all color changes, and if there are color changes, then this test is positive. After completing the procedure, remove your gloves and perform hand hygiene. Then for blood glucose, you're going to begin by for blood glucose, you're going to, of course, perform hand hygiene and apply gloves, and you're going to instruct the patient to perform hand hygiene and rinse and dry their hands. Then you are going to begin by removing, getting a vial testing strip out and placing it in the blood glucose meter. Check the vial for the code that will match when you place, that should match when you place the test strip into the meter. When you place the strip into the meter, it will automatically turn on. Then remove the test strip, placing it on a paper towel with the test side up. Then press the confirm button to confirm that the code shown on the meter matches the one shown on the vial. Then you are going to perform hand hygiene and apply gloves, prepare the lancet. To prepare the lancet, you're going to remove the cap and then take the cap off or remove the protective covering on the tip of the lancet, and then place the cap back on top. You're going to cock the lancet and adjust it to the proper depth for depth puncturing. After that, you're going to inspect the patient, looking for a good place to stick. Normally the best place to stick is the lateral tip of the finger. Be sure, or try not to stick the central tip of the finger, because that there is a lot of nerve sensitivity there. When you are ready to begin the stick, you're going to squeeze the hold the patient's finger. You're going to cleanse the area with an antiseptic towelette, running in circular motions and allowing it to dry. Then you're going to place their hand in a position of lying down to draw blood flow to that area. Then you're going to place the lancet at the place for at the puncture site and press the release button. After lancet is after it is punctured, if blood does not immediately begin to appear, you can gently massage the tip of the finger until a blood drop forms. After that, take the meter with the test strip in it and touch the test strip to the blood drop. It will the blood will be wicked into the meter. Then remove the test strip and dispose of all supplies, and then remove gloves and perform hand hygiene. The test results will be on the meter, and you will read the test results and go over them with the patient and instruct them on further application if it is a new diabetes diagnosis. And then for the clean catch urine, you're going to begin by performing hand hygiene and applying gloves. Then you're going to assist or instruct the patient to clean the perineum with soap and water. Then you're going to remove your gloves and perform hand hygiene. You're going to open the specimen container, placing ensuring not to touch the inside of the container, and placing the cap inside up. Then you're going to perform hand hygiene and apply gloves, and you're going to assist and instruct the patient to clean the perineum. For a male patient, to clean the perineum, you're going to hold the penis in your non-dominant hand, cleaning with an antiseptic towelette, going from center to the outside in circular motions 3 times, with each time you're going to use a clean towelette. And I'm going to go and correct myself. After opening the kit, you need to pour the antiseptic solution over the cotton balls or towelettes. So after cleaning the center to out 3 times with using a clean towelette each time, then if the male patient is uncircumcised, you will instruct the patient to retract the foreskin to effectively clean the medius and keep it retracted for the entire specimen collection. For a female specimen cleaning the perineum, you're going to instruct or assist the patient by separating the labia minora, and with an antiseptic cotton ball or towelette, you're going to wipe front to back 3 times, cleaning the entire urethral area, starting with the farthest from you, the closest to you, and ending with the center. And for each of those, you want to use a clean towelette or cotton ball. Then, moving on to the actual specimen collection, you're going to instruct the patient to initiate urine stream and pass the cup through the urine stream, collecting 90 to 120 milliliters of urine. Pass the container back through the stream and secure the lid tightly on top. If there is excess urine on the outside, be sure to wipe that off and ensure that it is clean. Then you're going to label and send to the lab, perform hand hygiene, and remove your gloves and perform hand hygiene. Then for a 24-hour urine collection, you're going to begin by placing a container into the patient's bedroom, in their bathroom, and posting signs on their in their toiletries area and on their door, informing patients and staff that there is a specimen time being recorded. Then you're going to perform hand hygiene and apply gloves. You're going to discard the first voided specimen, urine specimen, and that is when your that's when your test begins. So you're going to write that on the lab requisition of when it begins. Then you're going to collect make sure to instruct to collect every urine void during that designated time period. When the designated time period is completed, you will perform hand hygiene and remove your apply gloves. Then you're going to collect the urine specimen and inform the patient that the specimen collection time period is completed. And then that's it. Just cut it.